Understand.
Toxic shock syndrome is a rare but serious medical condition caused by toxins produced by a bacterial infection. Although toxic shock syndrome has been linked to tampon use in menstruating women, this condition can also affect men, children, and people of all ages due to different reasons. Infection usually occurs when bacteria enters the blood through an opening in the skin. For example, bacteria can enter through a cut, sore, or other wound. Risk factors for this condition include a recent skin burn, skin infection, surgery, recent childbirth, also the use of diaphragm or vaginal sponge to prevent pregnancy. Symptoms of toxic shock syndrome can vary from person to person, but in most cases, symptoms appear suddenly. Common signs of this condition include a sudden fever, low blood pressure, headache, muscle ache, confusion, diarrhea, nausea, vomiting, rash, redness of eyes, mouth and throat, and seizures. Toxic shock syndrome is a medical emergency. Some people have to stay in the intensive care unit for several days, and your doctor will most likely prescribe an intravenous antibiotic to help you fight the bacterial infection. Also, other treatment methods for toxic shock syndrome can vary depending on the cause. For example, if a vaginal sponge or tampon has triggered the toxic shock, your doctor may need to remove this foreign object from your body. If an open wound or surgical wound caused your toxic shock syndrome, the doctor will drain pus or blood from the wound to help you clear up any infection. You will also receive medications to stabilize blood pressure, boost your body's immune system, and intravenous fluids to fight dehydration. If left untreated, toxic shock syndrome can lead to liver failure, kidney failure, heart failure, shock, or even death. Certain precautions can reduce the risk of developing toxic shock syndrome. For example, changing your tampon or sanitary napkin every 4 to 8 hours, washing your hands frequently to remove any bacteria, keeping cuts and incisions clean, and changing dressing often will help you prevent the toxic shock syndrome from happening. Remember, if you notice any of the early warning signs of toxic shock syndrome on yourself or on a family member who's had a wound, infection, or surgery, or has her period recently, please contact your doctor immediately or drive to the emergency room as soon as possible to save their lives. Wishing you all the best. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.